Welcome dear viewers to the video on factors affecting score tablet splitting and its evaluation. In this video mainly we are going to have the understanding about the factors which have a great impact onto the tablet splitting and the tests which are required to be performed for the tablets having functional scoring, or you may say as break line. So first is formulation, composition and design. So consider this thing as the design of the formulation have a impact on tablet splitting. The formulation of tablet may be immediate release, extended release, or it may have the design like muffs. The muffs tablet include the pellet formulation mixed with extragranular material and then compressed into the tablet. Now you will understand that the MUPS formulation contain tablet formulation with pellets. So if you break the tablet and the pellets, if these are lost, then it will add more amount to the loss in weight. So the 3% criteria will be very critical for MUPS type of formulation. The extended release tablet with matrix design contain the higher amount of polymer. So breaking the extended release matrix tablet may be quite difficult. Then IR formulation. So generally compared to other formulation designs, IR formulation may have the good breakability. Then manufacturing process. So for tablet formulation, manufacturing process may be direct compression, roller compaction, or other dry granulation techniques like slugging, and it may be wet granulation. So the formulation manufacturing procedure also have impact onto the tablet breakability and the split tablet testing. Tool design. Tool design is very important for the tablet formulations which have functional scoring. Always understand and study the tool design like flat tool design or standard concave tool design or deep concave tool design. Break line design. Generally, whenever there is a formulation with break line, the formulators try to increase the depth of break line so that the tablets can be broken easily. But it is not always the case. Sometimes the tablet thickness is small and giving the more break line depth will be impractical. Tablet shape. Round shape, oval shape, capsule shape or oblong shape and any other shape may have the impact onto the splittability. The oval shape or capsule shape tablet may have the more surface area to hold the tablet compared to the round tablet or other shape tablets. So capsule shape tablet with break line will be easier to break and to pass the tablet evaluation. Tablet size. If tablets are too small, then you cannot hold the tablet properly, and because of that the breakability may be difficult. So the tablet size affects the tablet breakability and the other testings. The other factors are like tablet hardness and the hardness range. So it is always desirable that the tablet formulation should have good hardness, because if the hardness is low, then the tablet will fail in friability for the split parts. If the tablet is too hard, then by hand it will be difficult to break the tablets. Then coating. The IR formulation or extended release formulation or MUPS formulation may have the coating. The coating will be film coating generally, as the functional coating uh, tablets are not scored. So whether the tablet is coated or uncoated, that will impact onto the tablet breakability. Then very important thing or very important parameter or factor affecting the tablet scoring is number of break lines onto the tablet. Whether the tablet is having one break line or two break line or more break lines. So that is a critical parameter. If your tablet is having number of split parts, then it will be difficult to handle the tablet, to perform the splitting, to perform the breakability, and to perform the stability. Then break line on one side or on the both side for same or different split parts. Some of the times it is noted that the same tablet is having one break line on one side and two break lines on the other side. So for such type of formulations, it becomes critical to do the testing for scored tablet. Then tablet composition, hygroscopic nature. If the tablet is having a hygroscopic nature or if it absorbs the environmental moisture, then the tablet may become sticky and it becomes difficult to handle. Then API sensitivity for degradation. If the tablet formulation contains the API which is sensitive to the environmental factors like light or humidity, that time handling the scored tablet becomes difficult. Then coming to the method and technique of splitting by hand and splitter design and quality. Always have the method written for splitting the tablets. Also, the people should be trained for tablet splitting. Also, whenever you are going to use the splitter, evaluate the number of splitters and select the best one. It is desirable so that your formulation will not fail because of the wrong splitter or splitter with bad design or the splitter with bad quality. Then number of strength of the same formulation. If the formulation is having number of strength, so some formulations will be having with break line, some formulation may not be or some strength will not be having the break lines. So always have a good understanding about the number of strength and the number of strength which are having the break line or not. Then API content uniformity, tablet weight and weight variation. See, the testing whatever is performed onto the split parts, these all the testings are required to be performed on the whole tablets. So if the CU is failing in the whole tablet, there are more chances that the split part CU will fail. It is very easy to understand that if your whole tablet is having weight variation or if it is having content variation, that time the split part will also fail. Stability of the formulation. So the intrinsic stability of the formulation, the tablet may be coated or uncoated, that is required to be evaluated in R&D scale. And based on that, the formulation, composition and manufacturing process should be finalized. Also, the patient related factors affect the splitting. See, the patient related factors like age of the patient or the method of tablet splitting used by the patient will also impact the tablet performance and breakability, or you may say that ease of splitting. So always it is desirable to have the optimum hardness so that the geriatric patients can split the tablets easily by hand. Always make a tablet batches with different hardness, and whenever you are going to finalize the composition, always have the splittability, loss of mass data, also stability data in hand for finalizing the formulation composition. So this is regarding the tablet splitting and the factors which are going to affect the tablet splitting and the tablet evaluation. I have made another video which is available onto the channel for the test which are required to be performed for the tablets with break line, or you may say the tablets with functional score line or functional score. So go to that video and have the good understanding about the topic. Tablet splitting is a topic of interest for the interviewers, and from these type of topics the interviewers check your knowledge and the depth of your understanding. I hope you like this topic. I request you to share with your friends and colleagues so that their knowledge will get improved. Please do like, share and subscribe to this channel. Thank you for watching the video.